Madison? Hi.
Madison, yes.
I'm Chris, a nurse practitioner student that's going to be finding out what brought you in today.
I've been hurting and burning whenever I urinate. I burn.
Okay, so you have pain when you urinate?
Yes, and it burns
And
too.
burning. Pain and burning. Now tell me, is that every time you urinate?
Yes, every time.
And do you know when do you remember this starting?
A week ago, and it's getting worse.
Can you tell me what you mean by worse? What's different?
Well, I would say mild when I'm not doing anything, but when I have to pee, it's up to like moderate.
So you don't really notice any discomfort until you go to the bathroom.
Well, it's mild when I'm not doing anything. I do
So
have
you are
discomfort.
aware that there's discomfort there, but it gets worse when you go to the bathroom.
Yes.
What else have you noticed? Pain, burning, some discomfort in between. Can you tell me anything else?
It burns even when I exercise or even when I have intercourse.
So there's a lot of times when you're aware of the discomfort.
Right.
Exercise. So like when you're do you feel it sitting there now?
Yes, a little.
But it's worse when you urinate.
Yes.
Is it worse with intercourse?
Too, yes.
What did you
Yes,
say?
with intercourse too.
Okay.
It works.
And exercise. But it's kind of there all the time.
Yes.
Right? Is there any time when you don't notice it?
Maybe when I'm sleeping and I'm forgetting about it.
Do you think that you could put a number on that pain?
Maybe 3 when I'm not doing any of those, and 7.
3 out of 10? If
Yes.
you're on that, what is it, 0 to 10?
Yes.
So 3 out of 10, like
If
now,
with normal activity, you are now, yeah, and then 7 out of 10 when I'm
when you urinate,
yes.
or have sex.
Right.
Are they all kind of
exercise.
equal?
It's about there, yeah.
Anything that makes it better? Have you tried anything to
I'm
feel
trying
better?
to drink more fluid, especially cranberry, but it hasn't helped
It
much.
hasn't helped.
But I'm
Anything else you've tried?
taking ibuprofen, 2 pills, and it helps a little.
How often are you taking that?
Maybe 3 times a day.
Anything else that you've tried?
No, that's it.
Citrate, ibuprofen.
Cranberry.
But you said it's getting worse
Yes.
over the week.
Yes.
The course of the week. And is that when you came in today? Because it's getting worse.
Yes.
Do you notice anything else? Like you said burning?
Well,
Any
you
other
know,
words that you would use to describe it?
no, I think it's just more burning and pain.
Achy? Any other sharp, achy, stabby,
okay.
anything like that?
No.
Okay. And where can you point? I know it's kind of awkward, but can you show me where you feel the pain?
Right here across my lower abdomen, below my belly button.
Okay. And is it kind of in a band?
Yeah, just across my lower abdomen.
Does it hurt? Okay, so that's pretty much it. Anywhere else that you notice the pain going to?
No.
And anything associated with the pain, and what I mean by that is like anything with your bowels or your vaginal area.
You know, I having this stuff coming out of my vagina. It's thick yellow.
Okay, so would you call that like a discharge from your vagina?
Yeah, I think so.
Not, you don't think it's from the where you urinate, but you think it's from the vagina.
I don't know. It's from that area.
And you said it's yellow.
Yes, thick and it's thick.
How long have you been aware of that?
For a week.
Same.
Yeah.
Has that changed at all?
No.
And have you tried anything to change the discharge? taken any medicines for that or done any special hygiene practices?
No, I haven't tried any medication except for just like flu and cranberry juice.
So same treatments you tried for the burning.
Yes,
You tried for the discharge. Nothing seems to make a difference.
right.
Anything else that you want to tell me about this? What's going on?
Oh, you know, it just hurt right after my period ended.
Okay. So the period ended like a little bit over a week ago, and then the symptoms started.
Right.
Is that, am I understanding it right? Okay. Have you ever had anything like this before?
Yeah, I had a urine infection 2 years ago, and it feels something like this.
Seems similar. So you think that might be what it is?
I think it might be the infection again.
The discharge as well?
Yes.
I'm going to ask you a bunch of questions about things in your body,
Okay.
and I will assume that you haven't had them unless you say yes.
Okay.
Have you had a fever? Chills? No, I'm sorry. I thought you were reading.
Yeah. Okay. Just go ahead.
Fever, chills, fatigue. Lost your appetite, night sweating at night, change in your weight, feeling weak. Okay. And in that vaginal area especially, any changes in your skin?
No.
Rashes, itching, lesions, bruising, bleeding, color change, or change in the hair?
No.
And so you've told me with the bladder area that you've had pain with urination. Do you feel like you're going more often?
No, I'm not going more often.
Do you feel like you have to get there urgently?
No.
Having to get up at night to urinate?
No.
Feeling like you can't empty the bladder? Having lots of urination? Dribbling the urine out? Any pain or in your back? And history of kidney stones?
No.
And any changes in your intestines, appetite, heartburn, nausea, vomiting blood, having pain, food intolerances, gas or bloating, indigestion, history of liver problems, constipation, diarrhea, bloating, blood in the stools, hemorrhoids, hernia, or rectal bleeding. And when do you remember having your first period? How old?
7 years ago. 13 years old.
Okay. And how long does the period usually last?
4 days.
And how frequently do you have your periods? How many days in between?
21 days.
You said you just finished a period about a week ago?
Yes.
So they're pretty regular?
Regular.
Regular? How would you describe the bleeding during your period?
Normal.
So
Not too much, not
moderately
too
heavy,
little.
not too much, not too little. Okay, and are you sexually active?
Yes.
Partners do you have?
Well, my entire life, 4.
And just recently in the last year? How many?
2. I just had a new partner 3 months ago.
You still have that same partner?
Yes.
And do you have female partners, male partners, or both?
Male.
And this current partner is male?
Yes.
And what kind of birth control do you use if you use it?
I'm using the pill and sometimes condoms.
You say sometimes, can you give me an estimate of how often you use condoms?
Maybe once a week.
And so how many times would you have intercourse without the condoms?
Maybe maybe 3 or 4 times a week.
Okay. So 1 out of 4 or 5 times maybe. Does that sound about right? And do you use any lubricants or anything like that during intercourse?
No.
And do you, for hygiene, vaginal hygiene, do you use any douches or any special body washes or perfumes? And I know you told me this earlier. You said there's pain with intercourse, correct?
Right.
Have you ever had what we call a sexually transmitted infection?
No, I don't think I ever had an infection like that before.
And have you, does this word sound familiar, like DES exposure? Have you
No,
or your mother been exposed to that?
no, I don't think so.
Have you ever had a pap smear?
No, I haven't had one.
Thank you. That was a lot of questions. So I'm going to ask you about your medical history now. Did you have any illnesses as a child or any surgeries?
No. Oh, I had surgery. I have my appendix removed when I was 10.
Any other surgeries or hospitalizations?
No.
And do you have any illnesses like high blood pressure, diabetes?
No, I'm pretty healthy.
No, nothing that compromises your immune system, no arthritis,
No.
allergies to medicine or food?
No.
And what medications do you take? Birth control pill.
Yeah.
What else?
That's it.
Any supplements? The ibuprofen.
Ibuprofen, yes.
Any herbal supplements? Do you know if you've had all your immunizations?
Yeah, they're all up to date. I took them all. I got them all. I think.
Do you exercise?
Yeah, I run a couple times a week.
How far?
2 miles. Maybe 3 times a week.
Okay. What kind of diet? How would you describe your diet?
I think it's pretty healthy in the morning. I have oatmeal and then a sandwich for lunch, and then some rice or pasta with a little bit of meat for dinner and vegetables. I think it's pretty healthy.
And do you smoke?
Yeah, I do.
Tell me about that. How much?
Half a pack in a month. So just when I go out.
A half a pack over the course of a month?
Yes.
Okay, so not even 1 cigarette a day.
Right, only when I go out and social life.
And alcohol? Oh, and I'm sorry, how long have you had that smoking habit?
4 years.
Okay. Any alcohol that you drink?
You know, I'm going to parties on the weekend when I drink beer or mixed drinks
On the weekends?
on the weekend.
Saturday, Friday and Saturday?
Yeah.
Okay. Any marijuana use, cocaine, any other drugs?
I smoke marijuana on the weekends with my boyfriend.
And questions about your family. Any parents living?
Yes, my parents are alive.
And do they have any health problems like diabetes, high blood pressure, heart problems?
Well, my dad has high blood pressure and high cholesterol.
And your mom?
My mom is healthy.
Any siblings?
No.
Sorry, I've got to go back. Did you tell me everything that you wanted to about the health of your parents and no siblings?
No, I think everyone is healthy otherwise.
I forgot to ask you if you have ever had a pregnancy.
Never pregnant.
So, I'm going to do an examination.
Okay.
Now we're trying to figure out what's causing the burning and the urination and the discharge. discharge.
Okay.
So I'm going to ask you, actually before you lie down, I just want to look at your back.
Okay.
You said you're not having any pain back here, but I'm wondering if there's any tenderness.
No.
So I'm just going to press up. With that fist there. I don't want to pound your first.
Yeah, I usually
Do you
just.
just pound her?
Yeah.
Okay. Yeah. Oh, that's perfect. Yeah. Any pain there? Sorry, you pound her.
No pain.
Okay. All right.
I just give him a.
Just in case.
Yep.
All right. And I have you lie back. Okay. And I'm going to just look at your tummy. And I'm just observing the skin and looking for pulsations. Yes, abdomen looks flat. No pulsations. No, nothing that I'm concerned about with your skin. I'm going to listen to your tummy. So I'm just going to put my stethoscope in several places on your abdomen. Are you comfortable?
Yes.
You don't look very comfortable. All right, here we go.
My bowel cells are decreased.
Yes, they are.
And this group.
What's that?
On this group is decreased.
And they are. They're kind of quiet.
That wasn't tender at all.
Okay, now I'm just going to make some tapping on your abdomen. Do you want to bend up your knees? Okay, so I'm just going to feel my fingers.
And explain to her that we're not back up check up on her.
Tell me if anything is uncomfortable. Like right here?
Visual exam.
And what about all over? Just down in the same area. Right there. How about over here? I'm going to press a little deeper.
Observe that for any abnormalities.
Okay. Okay. Great. Sorry.
Then it would be Alice.
Okay. I'm just going to ask you to take a deep breath in. Just out breath. Same thing over here. Yeah, I'm just going to ask you to put the gown on. And I'm going to, you have had eczema before? Never. Okay, so this is new. So I need you to put the gown on and then lay on your back with your knees up. And I'm going to show you what the speculum looks like. So I'm showing it to you. And I'm just going to show you, I'm going to make it warm with some water. And first I'm just going to look at the outside of your vaginal area, and look at your skin. And then after I've looked at you and touched you very gently with my arms, I'm going to touch the vaginal area. And then is it okay if I insert this back in? Okay, because I kind of want to see what you look like on the outside, but also on the inside. We'll also send a urine specimen and try to get some information. If maybe because you've had a bladder infection before, you might have one now. Okay? So I'm going to keep my hand on you. Well, kind of. And then I'm just going to, you're going to feel my hands coming down your leg, and I'm going to touch, I'm going to look at that side. So it looks like you're kind of red. Are you kind of red on the outside?
No, normal outside.
Okay, so everything looks fine on the outside. So I'm going to just really gently put the speculum into your vagina. Are you doing okay? And then you'll you'll probably feel it opening up a little bit. You might make some noise as I lock it. I'm going to look at the cervix, which is at the end of your vagina. And look at that. that and I see the discharge.
There is yellow.
Okay, so I'm going to take a culture of that and set that over here. And I'm going to look at the walls of the vagina. And I'm going to pull it back a little bit and close it and remove it. And if it's okay with you, I'd like to put my fingers inside the vagina so I can just feel. So I'm going to feel the CMT.
And it is mild.
Okay, so tenderness around. I'm going to put a finger on the outside of your abdomen and feel the uterus.
It's a little bit tenderness when
Tender
you're
there.
back.
And what about the next? Are those tender also? Okay. I would like to, if it's okay with you, also insert a finger into your rectum. Okay. Because then I can feel what it's like in between the rectum and the vagina. How does that feel? That's okay. So no pain there. Yeah. All right. So I'm going to take my fingers out. I'm going to give you some Kleenex to clean up with and let you get dressed. Okay, we'll get some information.